Hi guys, Dr. Heimlich DC here today, and today I'm going to be going over another hidden cause as to why you can still have hypothyroid symptoms, even though you're taking your medications, even though your lab tests are coming back as normal. And that reason is iodine supplementation. That's right, iodine supplements may be making you worse. Now when a patient has been diagnosed with low thyroid production, medically speaking hypothyroidism, one of the first things that gets commonly prescribed is iodine. Now, you've probably been told that iodine is necessary for thyroid hormone synthesis, and it is. But here's the problem. Taking supplemental iodine can be disastrous, and here's why. Worldwide iodine deficiency is a widespread problem. In those areas of the world where iodine is deficient, iodine is the #1 cause for most of the cases of hypothyroidism. But areas where iodine is not deficient in the food supply, including the United States, iodine deficiency is usually not the cause of low thyroid. In areas of the world with adequate iodine in the food, where salt's iodized, most common cause of low thyroid is Hashimoto's autoimmune thyroid. It's estimated up to 90% of the causes of hypothyroidism in the United States is an autoimmune mechanism. And autoimmune thyroid is not primary hyperthyroidism. Instead, it's a form of hypothyroidism that's caused by the immune destruction of the thyroid gland. Now, the amount of iodine that's contained in iodine supplements and thyroid natural support products can act like gas on a burning fire. In 2004, Thyroid Journal stated that the explosive mix of iodine, TPO antibody, and H2O2 necessary for thyroid production and synthesis inadvertently provided a trigger for the autoimmune thyroid response. It's this misguided inclination to give everybody who's a hypothyroid patient high doses of supplemental iodine that leads to increased thyroid gland destruction and more suffering on the patient's part. Now, most natural healthcare practitioners possess a very limited understanding of the autoimmune system and physiology, and continue giving this iodine supplementation for all cases of hypothyroidism. And in the same way, medical community uses thyroid replacement hormones, kind of as the blanket treatment for all low thyroid conditions. What that means is that iodine is a trigger, and it's a trigger for Hashimoto's thyroiditis. And like I said, Hashimoto's thyroid is the #1 cause for low thyroid in America, not iodine. Now, this whole issue of iodine exposes a nasty similarity between traditional medicine and alternative medicine. Traditional medicine looks at TSH, T3, T4. They don't really care about the iodine. They're not going to give you iodine because whatever the real cause of your low thyroid symptoms might be. I mean, the only thing you're going to get is replacement hormone therapy. I mean, it doesn't matter. I mean, if you pretty much have a hammer in your toolbox, everything's going to look like a nail. You've heard that saying before. I mean, they don't care if the cause of your symptom is Hashimoto's, T4, T3 underconversion, overconversion, problem with thyroid binding globulin. It doesn't matter. You're going to be getting the thyroid hormones from the traditional medical doctor. That's why so many people still feel like terrible and symptoms. So traditional medicine has a nice little box, you've heard thinking outside the box. Well, traditional medicine has that little box. It's dusty. It's been sitting there for 30, 40 years, but that's how they do it. Then over the other side, we've got alternative, or not so alternative medicine approach, where what they do is they have their own little sad, outdated box and way of thinking. Inside that box is the idea that everyone who's low thyroid has a need for iodine, or tyrosine, or an immune-based support that they need to take thyroid glandulars. And here's what the not-so-alternative medicine doesn't know. Conventional medicine does some testing. But the not-so-alternative medicine, they don't really do too much testing. A lot of times they're still doing things like Barnes underarm thyroid test, an ancient, prehistoric, non-useful way of evaluating the thyroid. They're also, in the people of this camp, do an iodine absorption test, as if that has any real relationship with your need for iodine. It doesn't. The craziest thing is that these not-so-alternative practitioners ignore the fact that iodine can trigger that Hashimoto's that we talked about. Now, if you want to give yourself Hashimoto's, keep taking the iodine or one of the not-so-alternative medicine doctors gave you. I know they mean well, and it's no slam on them, but the well-meaning alternative doctor doesn't understand the fact that what we're really dealing with the majority of the time is Hashimoto's thyroiditis, not low iodine. The problem's autoimmune, and you have to be, well, if you've been diagnosed with hypothyroidism, but not sure with your autoimmune, it's in your best interest to have a doctor check it out for you. Check your thyroid antibodies. This is going to indicate whether you have hypothyroidism is an immune cause, and it's going to help guide you with your decision on whether to include iodine supplementation in your diet. So that's pretty much it. That's reason number 2. Or excuse me, that's another reason for patients to have hypothyroid symptoms even though they're taking their meds and or taking their iodine.